Frustrated staff at Maxeke Johannesburg Academic Hospital have written to President Cyril Ramaphosa seeking his urgent intervention in an ongoing crisis as the province heads into a predicted fourth wave of COVID-19 infections. They painted a grim picture, saying that they encountered obstacles while trying to re-establish services, including the theft of critical equipment, copper pipes and delays in the reopening of the emergency department. The hospital never fully recovered from a fire outbreak in April this year. The recent flooding forced the closure of 7 wards that housed 200 beds and 2 intensive care units. We reached out to the CEO of the Maxeke Hospital, Dorothy Bogoshi, and the Office of the Gauteng Health MEC responded, saying that they would not be commenting on the matter until further notice. Joining us to discuss the state of the hospital is Jack Bloom, the DA spokesperson on health in Gauteng. Mr. Bloom, good morning. We couldn't get a comment from Maxeke Hospital. What are your comments regarding what is a terrible situation from what we hear at Maxeke?
Well, first of all, the lack of communication. I mean, the department and the CEO should be communicating about what's happening. Because I get calls every day from very distressed patients. And, you know, people have been waiting for operations for years, and people who very urgently need cancer treatment or heart treatment, and they don't get any answers. I think this is a cry from the heart from these staff at the hospital that has written to the President of the country. And I really think it needs to be responded to. Just the problem at Gauteng Health Department is that very poor track record as far as building repairs and maintenance. The flooding that we saw last week is really the result of years of poor maintenance at the hospital. They've had other flooding incidents before, and this one was particularly tragic because they had to evacuate the ICU wards, including the ICU wards that we're very much going to need with the latest fourth wave. So I really think the department needs to tell us very firmly what are they doing to fix up this hospital and when is it going to be fully reopened.
Well, you speak about the department talking to us about what they're doing to fix the hospital. In the intro, we talked about the fire that broke out in April sometime and how the hospital has not fully recovered. Now, fully recover from an incident that just is not something that we should really be talking about, particularly where we're in dire need of bed space.
Well, absolutely. I think it's just unthinkable that this major hospital in Gauteng, which doesn't just service Gauteng, it services neighboring provinces as well, it's a national asset, is just drifting at the moment. I mean, I would have thought we'd get the best brains from the private and public sector, which is actually what this letter to President Ramaphosa is calling for. Let's have a joint task team. Earlier this year, the DA called for a private-public partnership. That's what we need, because unfortunately the Department of Infrastructure Development, which is the provincial department that is responsible for repairs and maintenance, is just a shocking department, to be honest. They never complete anything on time or within budget. And we've heard one estimate is that the entire hospital will be open in 2024. I mean, that's years ahead. Sections will be opened block by block. That's what they've also said. But I don't think that's good enough. I think we do need this joint task team that's been proposed by the people who sent the letter to President Ramaphosa. Let's do it now. I think we've got the skills in our country. If we get extra funding from the national department, which I think is necessary. That's why I think they've written to President Ramaphosa. And it's a national priority to get this hospital working. Why are we not seeing the urgency that it requires?
Mr. Bloom, that potentially for me is the first problem, and that we have to get a task force together to assist people who are employed to do a particular job that aren't actually doing that job.
Well, it's very sad, but the skills simply aren't there, which is why I called for a private-public partnership earlier this year. You know, this hospital was in April this year. What have we seen so far that gives anybody any confidence that they can do the right thing? So I really think they need to admit that they don't have the skills to do it. They must get a proper budget and reopen this hospital. You know, people phone me in immense suffering and anxiety because they simply don't get responses from the hospital. What the letter details is that staff from the hospital have been dispersed to other hospitals which are terribly overstrained. I mean, we all know that Helen Joseph Hospital casualty is such a disaster. People crowd in the casualty department. It can take them days to get admitted. And on top of all this, the fourth wave of COVID cases is extremely steep. And I think we can expect a rush of cases. And meanwhile, this major hospital of ours is only partly functional. It's just wrong. And I think it's every effort needs to be made to fix it as soon as possible.
Well, I'm surprised you're not calling for the head of the institution, or certainly some heads, to roll in the Department of Health. Because surely it's not about bolstering those that are weak in those positions, as you suggest. Should they not be taken out and be replaced by individuals that are sufficiently competent?
Well, I've said that all along, is that we need to put the right people in the right positions to fix up this department. But look, the fire happened in April. We don't even have the results of any investigation as to why it happened, and the role, or the accountability role of the present chief executive officer of the hospital. Why is she still in her job, actually? What accountability is there for anything? I do think the fire could have been prevented. Preliminary indications that they didn't do the proper checks beforehand. We don't have answers on that. So I think it's for the public to raise its voice. The staff have now sent this very traumatic letter to the President of the country. President Ramaphosa, you need to answer this. People are suffering, and we need to know what is going to be done to open this hospital fully as soon as possible.
Now, obviously, the President's office is the highest office in the land. What does that tell us about the other offices between the President, certainly, and the hospital in terms of their functioning, or the faith or lack of faith that certainly Professor Adam Mohammed, who penned the letter, has in those institutions?
Well, obviously, they lost confidence in the provincial government. It falls under the Gauteng Health Department, and repairs and maintenance falls under the Department of Infrastructure Development Department, and I don't blame them. We've just seen incompetence after incompetence for years now. Corruption is absolutely all over the place. I mean, we've seen several hundred million rands of money going to waste on the PPE scandal. There's a hospital in the far west rand, the Anglo-Ashanti Hospital. They spent 500 million rand fixing up this hospital, and has hardly seen any COVID patients. So with a hospital and a department that is this incompetent, I think that the President's office does need to step in. Something needs to be done, and if we get the best brains in the private sector to assist, I'm sure it can help.
Mr. Bloom, thank you for your time this morning. Dear Spokesperson on Health in Gauteng, Jack Bloom.